Thank you so much, Mr. Speaker. And I rise today to talk about our veterans. Memorial Day was just this past weekend, and we honored those who paid the ultimate sacrifice in defense of our nation. This weekend also, veterans from our great country journeyed here to our nation's capital to visit the monuments that were publicly erected in their honor. I am so proud that a group of over 60 veterans living in South Florida, including David Milan, Don Lowe, and Agustin Fernandez, were able to make the trip on the first ever honor flight from Miami International Airport located in my congressional district. They, like all veterans, are true American patriots, courageous and brave, putting others before themselves, willing to stand up and fight for our nation's ideals and for the spread of freedom, peace, and prosperity abroad. That's who they are. It's in their DNA. My family and I, we know the sacrifice and the courage and the resolve that is required to dedicate one's life to the service of our country. My husband, Dexter, proudly served in Vietnam as a U.S. Army Ranger, earning a Purple Heart. My stepson, Douglas, and his wife, Lindsay, both served tours of duty as active duty Marine Corps aviators in Iraq, with Lindsay also having served in Afghanistan. They are still serving our nation as Marine reservists. I could not be prouder of them and their fellow veterans, and have the highest respect for the families and caregivers who support our vets after they return home from their missions. I recognize that we can never repay our veterans in full for their contribution, but we must certainly try. And I'd like to think that all Americans feel the same way. A key part of our nation's commitment to our veterans has always been providing them with quality health care, especially with respect to injuries suffered in the line of duty. But more than a year after the most recent VA health system scandal rocked this administration and forced the replacement of a cabinet secretary, the VA's commitment on health care continues to fall tragically short. A year later, the number of patients facing long wait times is still the same, and somehow the number of patients waiting more than 90 days has actually doubled. A year later, the VA health system continues to fail our veterans. We know that they have the right stuff. These veterans do. The selflessness, the courage, the pride that they demonstrated in defense of the American way of life. But what must they think of our government now? Unconscionable long wait times, bureaucratic mismanagement, top-down rationed care. These are all well below the bare minimum standards any American should expect. Yet this is exactly what the VA under this administration continues to offer our veterans. At least this Congress has pushed for reform, for access, for choice. In the last year, we have passed laws that set out to improve access for veterans seeking medical care and mental health services. Congress also provided the VA with $16 billion to shorten wait time and improve health care quality. I've joined many of my colleagues to demand that the VA publicly release the findings of 100 internal health care investigations conducted since 2006 to enforce accountability at the VA. And I've also joined a bipartisan contingent of my House colleagues to offer to help the VA staff focus on providing quality health care by allowing congressional staff to serve as the primary point of contact for veterans asking about their claims and their long appointment times. But over and over again, Congress's efforts have been met by a stubborn bureaucracy that looks to skirt legislative intent on expanding veterans' access and choice and reforming the way that the VA health system does its business. I am committed to holding the VA under this administration responsible for the continued failings of our VA health system, and I will continue to fight alongside my colleagues in Congress for the reforms that will provide our veterans with the quality health care they deserve. And we know that our veterans should not have to wait another year. The time is long past. The time is now. So that next time that South Florida residents come to D.C. on honor flights to visit their war memorials, they will truly know that our nation honors their service by providing quality health care at all of our VA facilities. Thank you, Mr. Speaker, for the time.